In an ideal world, parents would start to think about prenatal screening before they fell pregnant. But yeah, basically we would like parents to start thinking about prenatal screening as soon as they are pregnant. I do try and encourage my young women when they come for a pill script or anything else to start, asking them at that stage, are they considering a pregnancy in the next little while? And at that stage, saying that they need to come and undertake various investigations, think about some prenatal vitamins, all those sort of things. And at that stage, I also would mention prenatal screening, just so they can start having that in their minds. But certainly once the patient comes for their first visit and tells me that they're pregnant, I would probably introduce that at that point, at the time that I'm organising the blood test, organising the scan.
Prospective parents need to have at least a basic understanding of the prenatal screening process. And the pieces that would make the most sense and are most important are what the options are, so the types of prenatal screening available, what the potential things are that can be screened for. So for example, ultrasound is for birth defects and structural problems, but can also be used to help generate a risk assessment for certain other conditions like chromosome conditions. Blood testing is going to help with some information, but not the same amount as ultrasound, which is why understanding the whole process is incredibly important. Each piece of prenatal screening gets put together to create a better picture for what the potential risks are. I think the other things that matter for prospective parents to understand is accuracies, where some things are very, very accurate for certain types of prenatal screening are very accurate for certain conditions, and others will require additional information. The main one that's most common is ultrasound. So you can have an ultrasound at different stages of your pregnancy, and they each have different helpfulness. So for example, in the very early first trimester, we're trying just to make sure the pregnancy is still ongoing. The next step would be to make sure that there were no obvious structural abnormalities early in a pregnancy that would lead us to think about testing or doing more screening. The next one would be your common, what's called a morphology scan, which is an overall structure scan of your baby when the baby's big enough to actually see internal organ structure. So that focuses a lot more on the heart structure and the brain structure. And then later on, you may have growth scans that help us screen for how the pregnancy is progressing, how the baby is growing, how the fluid is looking around the pregnancy, how the placenta is working, to help guide when we need to deliver or when we need to intervene. You then have another subset of screening tests, which is primarily biochemistry. So that's blood. And you can have early blood tests, or you can have later blood tests, and you can use some blood tests in combination with a scan to generate different risks. A lot of those are focused on chromosome abnormalities like Down syndrome, but also there are blood screening tests to help us better understand mom's health so that we can better understand additional screening that might need to come from, say, later ultrasounds, things like preeclampsia, those types of high blood pressure issues that can occur later in pregnancy that can impact how we deliver. Not exactly for outcome of baby for sure, but helping to guide how we monitor her going forward in a pregnancy. And then you have your diagnostic tests, which aren't screening, they're an actual answer. So if any of the screening options come up that make us raise a risk or a concern for the possibility of an underlying genetic or chromosomal condition, then we need to go to diagnostic testing. So parents can make informed choices throughout the prenatal screening journey by talking openly with their health providers about what their hopes are for the end of the journey. So for example, if they know that they would not interrupt a pregnancy with Down syndrome, that they would raise a child with anything, maybe they don't want to take as much of the screening options. They need to be able to talk about that. If they know that they might make different decisions based on how results come back, but truthfully they don't know how they're going to react, and that's usually the truth in most scenarios, offering them everything with an open description and allowing them to decide the next best steps. So parents can also and should also feel comfortable being able to ask for more information. So if something's not clear and they'd like more information, asking their health professional, where can I get more? What would it be like to raise a child with Down syndrome? I don't actually even know, so how can I decide about screening? And directing those people to websites such as the Down Syndrome Association, get more ideas, talking to parents who have kids with Down syndrome who are willing to speak to you. There are a number of common causes for confusion about the prenatal screening process. First off, from a health professional, understanding timing of when things can happen. So some of the prenatal screening options need to happen within a certain time window. And in order to do that, that means we need to catch the prospective parents, maybe even before they're pregnant, to talk about what these choices would be. When someone shows up in a GP's office and they may be early on in pregnancy, say 3 or 4 weeks, they actually need to talk to them about everything that's going to happen for the next 10 weeks so that they can make sure they get the referrals in place, so that they know what their choices are. And that can be quite a long conversation, which means that people get confused or don't hold the information. And so it's real important as well to provide them with written info about what the options are that were discussed, as well as the various referrals at the time of that first appointment.
In my practice, I do have some information that I can print and give out to patients. I routinely use one of the brochures from Genetic Health Queensland, which I think was developed by Metro North Health and Hospital Service. This prenatal screening website is also a fabulous resource that I've been very impressed by, and the brochures that they've developed I think are great resources for you to look through, and certainly for you to bring back any questions that you have or queries that you have to discuss with me further.